Heart-safe motherhood was a life-saving intervention for me and my family. So with my first daughter, I experienced preeclampsia directly after delivery. I delivered my son through an emergency C-section. Upon discharge, my medical team started me on the Heart-Safe Motherhood program, which required me to check my blood pressures through the app. My blood pressures were a little bit more elevated, but I just thought it was due to not having enough sleep with a newborn, and I was honestly gonna ignore it. And the app referred me to contact my primary team, found me to be in preeclampsia, and my liver enzymes were out of this world crazy. So for me, it was completely life-saving.
Heart-Safe Motherhood is an automated, bi-directional, text-based program. We're able to monitor blood pressures after patients go home when they've been diagnosed with some form of pregnancy-related hypertension.
Patients are at highest risk of stroke in the first 10 days after the delivery. When they send us their values, they get automated feedback telling them whether their blood pressure is okay, a little bit high, or dangerously high. We're able to connect with the patient and figure out the best next steps to keep them safe.
I knew because of this program, my chances of making it back home were possible. Without this program, it could have been my husband raising my children without me, and that's unbearable to think about.
Preeclampsia is one of the leading causes of maternal morbidity and mortality. It disproportionately affects Black patients, and it's one of the leading reasons that people have to get readmitted to the hospital after delivery.
It just seemed like a preventable problem. If we could get that information sooner.
We have this sort of, I think, realization. We didn't really need to see them, we needed their blood pressure. And so could we get that in a different way?
Heart-Safe Motherhood allows us to get the blood pressure information that is needed in over 90% of patients, and that's regardless of race or insurance. And previously, when we were asking people to come into the office for blood pressure checks, we were only at about 25% for Black patients and 40% for white patients. And through this program, we've shown that we've reduced the disparity and improved care for all comers.
And it actually almost eliminated all of our readmissions due to high blood pressure.
So I see a lot of these patients in my cardiology clinic after they've participated in the Heart-Safe Motherhood program. And what I hear over and over again is how grateful they were. Receiving a diagnosis of hypertension can be a traumatic experience, but despite that, they felt someone was looking out for them. And I think a lot of people who otherwise wouldn't be engaging in the healthcare system continued to participate in care. And I think that's really powerful.
After a delivery, there are a lot of barriers to in-person care, and especially in the underserved communities. And what Heart-Safe Motherhood tries to do is to overcome some of those barriers by basically eliminating them. If they don't need to get on a bus to come to their appointment, they don't need to pay for parking for a 10-minute visit, and they don't need to find childcare. It's all about the patients, and I think that's something that Dr. Cooper is known for, and that's something that our program really strives to do. It's truly an honor to receive the Edward S. Cooper Award. When I started this, never imagined it would get to where it is now. We took an idea and we've shown that we made a difference, and not just in our direct community, we've expanded it to a lot of other hospitals. We've reached so many patients. We've got hundreds of thousands of blood pressures, reduced so many readmissions, we've reduced so many complications. It's great when patients come back to us and say, this program made a difference. And to us, that was the mission, and it's nice to see it, in real life.
I believe everyone deserves to have access to equitable health care, regardless of your gender, your background, your zip code. I believe that the American Heart Association strives for that each and every day. And I believe that the Heart-Safe program does so as well.